Which of the following conditions is most likely responsible for her symptoms? A 32-year-old woman is brought to the clinic by her husband, who reports that she has recently been experiencing episodes of memory loss. She has no recollection of the events that occurred during these episodes, although her ability to form new memories remains intact. The patient has no history of head trauma, seizures, or substance abuse. Her vital signs and physical examinations are unremarkable. Which of the following conditions is most likely responsible for her symptoms? Well, I was at first thinking, like, when I was listening to the or hearing myself say this, I thought it was Alzheimer's disease, but she's 32, so that's probably not the case. Um, so I'm gonna say no to that. So no Alzheimer's. This is not, in my opinion, ischemia, a transient ischemic attack. There's no like sensory loss or anything like that, right? Yeah, just memory loss. Dissociative amnesia, I think that's when you have like trauma or something like that, and you kind of associate like you can't remember. No, wait, dissociate. I don't know. I don't think that's the right answer for some reason. Or Nikki Korsakoff. So that is, it's not schizophrenia. Um, I don't know if I feel like I knew what dissociative amnesia was, because I think where Nikki Korsakov is with alcohol. Like you drink a lot of alcohol. She has no history of substance abuse. It maybe it's dissociative amnesia, and I'm just wrong. Um, During these episodes, she although she had a wait shit. During these episodes, although she's able to form new memories and they remain intact, she has no history of trauma or substance abuse. I want to go with dissociative amnesia just because I feel like if where Nikki Korsakov was the answer, they would have said she has a crazy alcoholic like past, and so I would go with that.
Yeah, so this is kind of interesting, right? Dissociative amnesia, right? Age, recent memory loss, recollection of these episodes, inability to form new memories, dissociative amnesia. Dissociative amnesia, right? Usually inability to recall important personal, usually stressful or traumatic events. They don't really say, right? They don't give you, but
Mhm.
this one's really, really tricky, I would say. So let's kind of work through it together. We know that A is the best answer here, but let's look at the other ones. First of all, her age is super important. Alzheimer's is usually older, even early onset Alzheimer's is going to be 60, 70, right? 50, 60, 70, right? So way too young for that.
Yeah.
Transient ischemic attack, pretty rare in a young woman at 32, I would say. Wernicke-Korsakoff syndrome, right? Like you said, that's more alcohol abuse, right? You have confabulations, you make up stories, things like that. Schizophrenia definitely doesn't have those extra symptoms of flat affect, right?
Yeah.
Delusions, things like that, right?
More common
So
in men.
exactly. So main thing here is going to be your best answer is going to be dissociative amnesia, right? Just even though they don't give you kind of that, a lot of the times, right? This is a little bit tricky, right? But just remember, a lot of the times on your step one exam, they'll give you history of, personalized trauma, right? They'll give you some kind of like, oh, maybe a, you know, um, near life uh, death event, right? Things like that. But here they don't give you that. But the only one that fits the best here with this kind of age range is dissociated amnesia.